So now for image evaluation, this is our AP Scout. So for the AP Scout, you just pretty much want to see that you have an empty bowel, and in this case, the patient did have an empty bowel. So that just helps us out in making sure that the patient did prep for the exam and took the laxatives that were necessary to empty out the bowel. So the next image that we're evaluating, it's a right lateral decubitus. And for this image, we're making sure that there's evidence of proper collimation, like any other image. Also making sure that there's no rotation of the patient as demonstrated by symmetry of the ribs and the pelvis. So as we can see here, we have the ribs that can be seen, the spine going down below and into the pelvis area. So that's one way of checking if there's no rotation. Another thing to keep in mind is that since it was a right lateral decube, on the medial side we'll have the right colic flexure and the ascending colon, which will be this portion down below. Then it's our transverse colon going up into the left colic flexure. Since that was our side up, that will be considered as our lateral side. So you'll have your left colic flexure, and then see the descending colon going down into the sigmoid rectum area down below. So that's a way to identify the image. Also, another thing is looking at the contrast. So as you could see, the contrast here, it's the white portion. You know that it's a decubitus image, and the marker up below, since it says it's the left marker, we know that that's the side up, so it will be considered a right lateral decube. So now this is our PA oblique projection, and the patient was in an RAO position. So for this image, our evaluation criteria consists of evidence of proper collimation, making sure that the entire colon is seen within the image, also that the right colic flexure is open, as it can be seen here, right colic flexure. Then we have our transverse colon, left colic flexure, descending colon, and over here on my right side I have the ascending colon. But most important, just making sure that your right colic flexure is open. Next is our PA projection. So for this projection, you just want to make sure that there's evidence of proper collimation. Also, that the entire colon is seen within the image along with the flexures. So here we have our right colic flexure, which can be seen, transverse colon in the center right here, and then left colic flexure. And another thing is just making sure that the vertebral column is center. So we could see here it is centered right down below. That way our ascending and descending portions of the colon are included. So we have the ascending colon and the descending colon, which goes down into the sigmoid rectum area. Next is our PA axial projection, and for this projection, again, just making sure that there's evidence of proper collimation within the image. Also that the rectosigmoid area is in the center of the image, which is this area down here below. So here we have our sigmoid colon coming down into the rectum area down below. And also just in some cases, in this image, we could see part of the transverse colon, also the part of the, I would say, left colic flexure up here above. But in some situations, you don't have to have the transverse colon or both flexures included, because mainly you're looking down in this area below, which is the rectosigmoid area. Okay, so now this is our PA oblique projection, but this is actually our LAO position. So for this projection, just making sure that there's evidence of proper collimation, that the entire colon is seen within the image. and that the left colic flexure will be open in this situation since the patient is in an LAO position. So as we can see here, that's our left colic flexure. On the other side, we have our right colic flexure, transverse colon, descending colon coming down. And on the right side, here is the ascending. So ascending, right colic flexure, transverse, left colic flexure, descending colon, but making sure that our left colic flexure is open, which is important. Now, this is our lateral projection, and it's where the patient was in a left lateral position. So for this projection, just making sure that there's evidence of proper collimation. Also, that the rectosigmoid area is in the center of the image, which is this region right here. So just making sure that it's in the center. Also, that there's no rotation of the patient and that the hips and femora are superimposed, which we could see down here below, that they are superimposed. And for this image, since our area of interest is the rectosigmoid region, which is seen here. Here we have our sigmoid colon. Down here we could see our rectum area. You don't have to have the entire large colon included in the image. Our next image that we're evaluating, it's our left lateral decubitus. And for this image, you're just making sure that there's evidence of proper collimation. Also, that there's no rotation of the patient as demonstrated by symmetry of the ribs and the pelvis. So here we could see part of the ribs, and then spine, pelvis down here below this area. And in this case, since they are in a left lateral decubitus, on the medial side, we'll be seeing the left colic flexure, also the descending colon. As for the top part, which is the side up, is the lateral side. We will see the right colic flexure down into the ascending colon, which we could see here. So this is our last image that we're evaluating, and it's our post-evac. So for the post-evac, pretty much you're just looking into see that the patient expelled as much as the barium as possible when they were instructed to go into the bathroom. So there is still content of barium within the image, but it's just making sure that a lot of it has been expelled and ejected out.